Hello, my name is Dr. Joshua Gottschall. I'm a pediatric otolaryngologist affiliated with Walt Disney Pavilion Florida Hospital for Children and the Children's Ears, Nose, Throat Associates here in Orlando and Maitland, Florida. Today I'd like to talk to you about ear infections in kids, a common problem that many parents have to deal with. A little bit more about myself. Again, I'm a pediatric otolaryngologist. Another way of referring to an otolaryngologist is a ears, nose, throat specialist. I've done additional training in pediatric otolaryngology, dealing with the more complex issues related to diseases in the head and neck in children. Pediatric otolaryngologists treat diseases in the ears, nose, throat, head and neck area that range from the simple to the more complex. That might be simple things such as earaches and ear infections to major airway disorders requiring reconstructive surgery, treatment of deafness such as cochlear implants. Walt Disney Pavilion at Florida Hospital for Children is a brand new facility with over 175 beds just for children, and it's continuing to grow. It is a beautiful facility, and the Adventist Health System in Florida Hospital spared no expense to create an environment that is catering to children and a real special place to be. They have over 90 plus pediatric subspecialists, and this list is growing. They have a state-of-the-art pediatric emergency room and a state-of-the-art pediatric operating room where many surgical specialists can focus on innovative surgeries and minimally invasive techniques. In addition, Florida Hospital has invested a tremendous amount of resources to create an experience for children where hospitals, being traditionally frightening places, can be a warm, friendly, nurturing environment. And the child life services that they provide for children really help to support that. First, I'd like to talk about the anatomy of the ear. Our ear is divided into three zones. One is the outer ear, two is the middle ear, and the third, deepest zone is the inner ear. And the outer ear is the portions that form wax where water can get in our ears. And the middle ear is the part of the ear that's behind the eardrum. And the inner ear is the part of the ear that's deep in the skull that helps transmit sound into neural impulses so that we can hear. In the middle ear, we have an ear tube called the eustachian tube. This is a natural ear tube that helps to regulate pressure behind the eardrum. And it's very important for normal hearing to occur that there be air of equal pressure on the outside of the eardrum and the inside of the eardrum. When children complain of ear problems such as earaches, loss of hearing, perhaps straining of the ears, and even dizziness, a thorough examination should be performed by your pediatrician, and your pediatrician may decide to have further evaluation by an ears, nose, throat specialist to diagnose more complex disorders, or for those disorders that are not easily treated with just medicines alone. The hallmark of examining the ear is using something called an otoscope, which is quite commonly seen and quite familiar to many children, and it's just a specialized flashlight with a special tip that can help us examine the ear. And in the slide in the bottom right, that's a normal appearing eardrum. Let's talk about diseases of the middle ear. One of the most common problems of the middle ear is something called otitis media. And all that means is inflammation of the middle ear. And inflammation can be due to infection, can be due to allergy, and other times it can be due to other causes, inflammatory disorders. The most common cause of inflammation of the middle ear in young children is not usually one single cause, but a combination of factors that are unique to young children. One being that children are not adults. Their anatomy is not quite mature yet. And this has implications in the natural ear tube that we have called the eustachian tube. And that eustachian tube, which allows pressure to regulate behind that eardrum, is not working well. Occasionally this eustachian tube can be locked, and any adult who has flown in an airplane with bad cold or allergy can attest to that experience. When this eustachian tube isn't functioning, oftentimes negative pressure can build up behind the ear, and as a result fluid can enter that middle ear space from its surrounding tissues. That fluid can cause a hearing loss because the eardrum can't vibrate normally. In addition, if that fluid gets infected, then that's the cause of the symptoms of an ear infection. And for a lot of kids, that could be fevers, earache, poor appetite, poor sleep, and loss of hearing. Other causes of otitis media in children have to relate to the fact that kids have more colds than adults do. And that relates to the fact that their immune system is just not quite as mature as the adult immune system. Kids who attend daycare have many more infections than kids who do not, and so we can extrapolate that kids who attend daycare have many more problems with otitis media than kids do not. And the medical studies have shown that to be the case. As we discussed before, some symptoms of ear infections is pain and fussiness. Kids can't tell us what's wrong oftentimes, and they can tell us through their ways, their own ways, and that is they could be unhappy and not behaving normally. At times, kids can be inconsolable. With ear infections, some parents report that children are seen tugging on their ears, and this could be a sign of a problem with the ears or an ear infection. Trouble hearing, oftentimes parents will say that, especially in older kids, that they have their television up loud, or they say "what" a lot. And younger kids, it's a little harder to do, especially if they're not talking yet. In more severe infections, occasionally we can see drainage from the ear, and that drainage is actually infection that has ruptured the eardrum. And this is a potentially more serious problem that you might need to see an ears, nose, throat specialist for. Oftentimes, ear infections are associated with upper respiratory tract infections or colds, and it's not uncommon for kids to have stuffy, runny nose, poor sleep, and poor appetite as a result. How do we prevent ear infections? Well, some simple steps that can help reduce the likelihood that we transmit infections from one person to the other can be a major help in reducing the number of ear infections people have, and not just ear infections, perhaps colds as well. We recommend that hand washing be a common practice, especially if children appear to be coming down with a cold. Trying to limit exposure to other sick children is an important step in that. This is the difficulty, especially in daycare, preschool settings, where many parents send their children to school with a mild cold and may not even be aware of it. Vaccination is very important. The American Academy of Pediatrics has recommendations that your pediatricians follow as far as vaccination schedule. And some of these vaccinations prevent serious disease. Some of these vaccinations prevent more common forms of disorders. So I strongly recommend that all children are vaccinated. We do see an association between ear infections and children who are exposed to cigarette smoke. It's very important to counsel our families, both parents, that cigarette smoking is detrimental to not only their health but their children's health. And it's quite important to avoid exposure to these children to smokers in general. We find that breastfeeding is protective to children with regard to ear infections, and with all the beneficial effects of breastfeeding on the overall health and relationship between the mother and the child, breastfeeding can reduce the number of ear infections and infections in general children have. We do not know that there is a direct correlation between allergies and ear infections by itself, but certainly allergies can affect the function of the eustachian tube, and we know that's detrimental. So controlling allergy symptoms could be an important factor. How do we treat ear infections? Well, quite truthfully, many ear infections probably begin and resolve without specific treatment. Occasionally, children might seem a little fussy. They might have some mild fevers, but nothing that a parent may rush the child to the doctor with. And quite oftentimes, children might have more ear infections than we are truly reporting. However, when infections become more severe, where we're seeing children with fevers, occasionally high fevers, marked fussiness and discomfort, drainage of the ears, hearing loss, effects on appetite and sleep, these children certainly should see their doctor. And oftentimes, if an ear infection is seen with these symptoms, an antibiotic is prescribed. And most children respond very well to antibiotics and then resolve their infection. It's also important to remember that we need to control our children's pain. They might not be able to tell us that they are uncomfortable or in pain, but As we mentioned before, they might not be acting themselves, and that might be their way of telling us they're in pain. And so it's important to treat their pain. We recommend treating pain for ear infections, acetaminophen or ibuprofen, which come in child-friendly preparations, liquid preparations that you can get over the counter. Remember, never give children aspirin. Complications of ear infections. Besides the symptoms of infection that hopefully we can resolve with antibiotics, parents often wonder what are the long-term consequences of ear infections, particularly recurrent ear infections. And there are concerns that we have for kids who have recurring ear infections or middle ear fluid that doesn't resolve. One of the concerns we have with recurring or chronic ear infections is hearing loss. When there's fluid behind the eardrum, a child is not hearing normally. Many of these children will have a mild to moderate hearing loss. That's reversible. However, children who have, say, monthly ear infections, they're spending more of their time with hearing loss, perhaps, during that course of the year than with normal hearing. There are a small subset of patients who don't have many ear infections, but there's fluid that persists and doesn't go away. And this fluid is just body fluid and not necessarily pus. And oftentimes these children will have no symptoms at all. And this is the more difficult child to identify because oftentimes the hearing loss has been present long enough that it can affect their speech and language development. And one of the chief causes of speech and language development in children is hearing loss. So one of the first things we do is test the hearing to ensure that the hearing is normal. Occasionally with recurrent ear infections you can develop a perforation or a hole in the eardrum. This is a problem that occasionally can cause hearing loss in and of itself. And this is a problem that might need surgery to correct it. Other less common but very serious consequences of recurring untreated ear infections include things such as meningitis, which is an infection of the linings of the brain. Our ear is located at the base of the skull, and its proximity to the brain and central nervous system structure is very close. Thankfully, this is less common, especially with routine vaccinations. Another cause of concern is something called a cholesteatoma. This has nothing to do with cholesterol or fat. What it is a skin cyst that has trapped in a pocket in the eardrum or ear canal. Problem with this cholesteatoma is that it can grow and cause destruction of very important bony structures, and this requires surgery to correct. Back to otitis media. For the vast majority of children, otitis media, when becoming frequent or causing hearing loss that persists for, say, greater than 3 months, one of the treatments is pressure equilibration tubes or ear tubes. And this is a picture of an ear tube in a real eardrum. And what this ear tube does is it does the work of our eustachian tube that's not working well. Remember, as the child grows, their eustachian tube is going to mature, their immune system is going to mature, and they're going to have less colds to boot. Putting an ear tube in prevents ear infections for many kids and helps to drain fluid so that their hearing is ensured to be normal. Another surgery that's performed in children with recurrent ear infections may be adenoid surgery. Adenoid is a tonsil that's located way back in the nose, as this picture is shown here. How the adenoid is related to ear infections is that the adenoid is located right next to the opening of the eustachian tube. When the adenoid is enlarged or inflamed, we believe that it can, in and of itself, make eustachian tube problems worse or be the cause of them altogether. As a result, your doctor might recommend having adenoid surgery in conjunction with putting ear tubes in. And what we find is that that combination for some children can make a dramatic impact on a number of ear infections and improvement in hearing. Thank you for sharing your time with me today, talking about ear infections in kids. Ear infections are occasionally serious problems and quite common and affect many of our children. And it's important that our parents learn to recognize the signs of symptoms of ear infections, how to prevent them, with common sense practices such as hand washing, avoiding contact with other sick kids, and making sure your immunizations are up to date. Parents should also recognize when they should see their doctor, and know that the majority of ear infections that children experience do get better on their own, but many times will require antibiotics. Don't forget to treat your children's pain. Pain is not always easy to tell, but certainly if your child is quite fussy, more than likely they can use some pain medicine. Finally, talk with your doctor about when the proper timing to seek specialist referral and seeing a pediatric otolaryngologist or ears, nose, throat specialist. Your child might benefit from additional treatment. If you have any further questions, feel free to submit them here online, and I would be glad to answer them. Thank you for being here with me today.